Okay, hello everyone. Thank you for joining us this evening. I'm sure we are going to have a lot more people signing on in the next few minutes, but I want to get started because I don't want to miss any of tonight's valuable presentation. I'm super excited for it. For those of you who don't know me, I'm Crystal Jacob. I am a proud supporter of the Lewis Hole Women's Society, and I am co-chair of the Development Committee. For those of you who don't know, the Lewis Hole Women's Society is a group of women in all stages and ages of life who are passionate about and committed to raising excellence in women's healthcare and treatments. The Women's Society raises awareness and important funds for a variety of initiatives at the Lewis Hole Hospital for Women. And we host our Mind and Body Talks monthly as an inclusive speaking series to engage and stay connected with our community. With that said, I would like to get started by introducing one of our Lewis Hole Women's Society supporters to share a bit about why she chooses to be a part of this amazing community. And that happens to be our amazing chair of the society, Lisa Diamond. So Lisa, I'll let you take it away.
Thanks, Crystal. Hello, everybody. Good evening. As Crystal said, I'm Lisa Diamond. I'm honored to be the chairwoman of the Lewis Hole Hospital Women's Society. When I'm asked why I support the Women's Society, my path for support is a bit unique, as I really have never had treatment at the Lewis Hole Hospital, but rather I watched and supported my brother and his wife with their journey with infertility. I spent many days at the hospital alongside my sister-in-law, watching and admiring the great care that she received. Their journey took them through many appointments and tests, and while it was obvious to see the advanced technology in use, we were able to witness the support of the doctors, the nurses, and sadly, as their journey ended, the support that's available from the hospital chaplain and the bereavement employees. This experience ignited a passion in me, and I realized a couple of things. First of all, we are a very lucky community to have such a treatment facility like this, where the focus is on women's health and research. And secondly, I knew I had to figure out how I could personally support. So in 2017, I joined the Lewis Hole Hospital Women's Society as a founding member. Then that took me to a role of the events chair for the events committee. And in April of this year, I became the chair of the society. We're a very dedicated, we're a small and mighty group, and I'm thrilled to be a part of it. During my tenure as chair, I hope that we can continue to grow our community, increase our membership, and increase funds for such important items of support that the Lewis Hole Hospital needs to continue the level of service it provides. In addition to my position with the Women's Society, my husband Gerald and I are also co-chairs of the annual Harvest Celebration, along with our partners in crime, Bhupinder and Saranjeev Lal. For those of you that don't know, this is an annual, the largest fundraiser for the Lewis Hole Hospital. One could say that the hospital is lucky to have supporters similar to me, but in truth, this support provides my life with happiness, and it truly fills my bucket. I'm lucky and thankful every day that I get this chance to be involved in such an amazing organization.
Thank you so much, Lisa, and we are so excited that you transitioned to being the chair of the Women's Society. You are doing excellent things, and we are grateful to have you as our leader.
Thank you.
So before we dive into tonight's session, I just want to go over a few housekeeping notes and how this evening will proceed. So tonight we are honored to have Dr. Stephanie Liu with us, aka Dr. Mom, and she's going to be talking about motherhood, parenting struggles, and a doctor's journey to becoming a children's author, and a well-known children's author in Edmonton at that. We are hoping you will come away from tonight's presentation feeling educated and inspired. And we want you to know that this is a very safe space. You can ask any questions, and we will definitely get to all of them as best as we can. So at the end of the session, there will be a Q&A, and we ask that you, if you have a question throughout the presentation, just enter it into those question boxes. We will go through them all at the end of the presentation and have a chat at that time. My co-chair, Rhiannon, will be moderating the question and answer period and wrap up this evening's events as well. We are also using live transcript for this evening's event. It's not 100% accurate, but it does help with inclusivity. And if you would like, you can turn that on your webinar as well. If not, when this is posted to YouTube, which will be tomorrow morning, the transcript will be available. Tonight we are using Zoom's webinar feature, so each of the panelists will appear as they speak, and you will not have to worry about your video, and we hope you enjoy tonight's viewing experience. So that's it for housekeeping, but before we get started, I just want to send a huge thank you to Alberta Blue Cross. They have continued to support this series monthly. They believe in our society and they believe in the outreach that we can give our community, and so we thank you guys so much for that. And Ashley from Alberta Blue Cross is going to bring us some greetings.
Hi, everyone. I'm so excited to be here tonight. My name is Ashley Balduke, and I'm the Community Impact Specialist for Alberta Blue Cross. This partnership means so much to Alberta Blue Cross, and honestly, what better way to spend a cold fall evening than getting this excellent health knowledge and interacting with this amazing group of people. Before we get started, I would like to do a land acknowledgement, and then I cannot wait to see what our speaker has to teach us tonight. All right, today and every day, we respectfully acknowledge that we are on the traditional lands referred to as Treaty 6 territory. We recognize that the City of Edmonton and us, the people here, are beneficiaries of this peace and friendship treaty. Treaty 6 encompasses the traditional territories of numerous Western Canada First Nations, such as Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We are taking this important moment here today to acknowledge all the many First Nations, Métis, and Inuit people whose footsteps have marked these lands for centuries. Thank you.
Thank you so much, Ashley. Now I have the honor of introducing tonight's guest speaker, and that is Dr. Stephanie Liu, a.k.a. Dr. Mom. Stephanie is a family physician and clinical assistant clinical professor at the University of Alberta. Stephanie graduated from Columbia University with a Master's of Science, and she completed her Doctor of Medicine at the University of Alberta. Dr. Stephanie Liu is the creator of an evidence-based parenting blog called Life of Dr. Mom, where her goal is to provide parents with accessible and credible information, which is medically based. She's also the founder of By Dr. Mom, a company that creates functional and educational children's products. Outside of work, Stephanie loves spending time with her husband, Graham, and her two children, Maddie and George. She also has an amazing Instagram, so for those of you who don't follow her, you should, and you will get a lot of great tips on there as well. So welcome, Stephanie.
Thanks so much, Crystal. That was a great intro. I'm feeling very, very cool right now. Thank you, Lois Hull. Thank you, Alberta Blue Cross. And thank you, Crystal, Rhiannon, and Paula and Lisa for helping organize this great event. So I'm just going to share screen right now. Perfect. Okay. So I'm so excited to be here, and what we're going to talk about today is motherhood, parenting struggles that I had along the way. I'm going to do some myth busting and share how I became a children's author. So this is the overview of the talk. So first, I'm going to tell a little bit more about myself, how I decided to get into blogging and my journey to medicine. I'm going to talk about motherhood and myth bust along the way. So things that I didn't really know as a family physician, but learned once I became a mom. I'm going to talk about hot tubs. I'm going to talk about sleep training, breastfeeding, screen time, working mom life, mental health, and how the pandemic has affected our mental health. And along the way, I'm going to talk about my books. So this is kind of me in a nutshell. So I grew up in Vancouver with my mom and dad and my little brother. My mom worked outside of the home during my childhood. And I think she's really influenced my career path and also showed me how to balance my personal life with my career goals. In this picture, I think I'm about 7 years old. And I remember even at this young age, I've always dreamed about being a physician. And I was very fortunate because after I finished university, I got accepted to the University of Alberta's medical program. During med school, I met my husband, Graham. We actually got married in med school. He pursued ENT, and I decided to pursue family medicine. Sorry, I'm a little thirsty tonight. And I'm so happy that I chose family medicine because to me, there's no better career that suits me as well. I love being able to see kids all the way to adults at end of life, and being able to follow people throughout the years has been such a special opportunity for me. And then a few years into my practice, something really exciting happened. We had our daughter, Maddie. She's in the first heart bubble there, and she's really been my inspiration. She inspired me to create Life of Dr. Mom, the evidence-based parenting blog, and also inspired me to start getting involved in making children's stuff. 2 years later, I had our second child, George. I'm really giving Maddie a lot of credit, and she really was the reason I started Life of Dr. Mom by Dr. Mom. But I really love this Georgie boy too, and he's been such a great addition to our life. So on the right side, this is my evidence-based parenting blog. I'm on social media, and really I started this because I think there's a lot of confusing information out there for families. Some of the info is really good, but some of it's kind of wonky and potentially dangerous. So that's why I wanted to create a relatable educational resource for families. And as we go through the talk, I'm going to talk about some books that I wrote that I think talk about some important health issues that we're dealing with right now. And these are for children. So let's do some pregnancy myth busting. So myth one, and this myth is something that my mom told me. Don't exercise when you're pregnant. It's dangerous for you and the baby. And you know what? My mom was so convincing that she actually made me look up the evidence again. And when I did, I told her, Mom, you are wrong. Exercise is actually recommended during pregnancy, but you are right. There is some things that we should be cautious about. Exercise is recommended because there's a lot of health benefits associated with it. It has been shown to reduce back pain, ease constipation, may decrease the risk of gestational diabetes and the risk of cesarean section, and also promotes healthy weight gain. And in fact, the SOGC, the Society of Obstetrics and Gynecology of Canada, and the American College of Gynecology actually recommend a minimum of 150 minutes of moderate intensity exercise every week. There are some things that we should avoid. One of them being aggressive stretching and lifting heavy weights. And the reason for that is when we're pregnant, we release a hormone known as relaxin. And this is what allows our body to grow and for ligaments to stretch. But when we allow for the ligaments to stretch, it can actually increase the risk of ligamentous injuries too. Contact sports should also be avoided, and things with a higher risk of fall, so skiing. Okay, the second myth is one that I really don't like because I'm a huge charcuterie fan. Deli meats are safe to eat during pregnancy. In fact, they are not, okay? We recommend avoiding deli meats during pregnancy. And this is because there's a risk of listeria. And although the risk of listeria from deli meats is low, there's still a risk. And when women are pregnant, they're actually at increased risk of food poisoning because their immune system's weaker than non-pregnant people. And if you are to get listeria, there is a risk of not only getting sick for the pregnant woman, but also for the unborn baby. So with listeria infection, there's a severe complication known as listeriosis, and this can cause meningitis and bacteremia, which is bacteria in the bloodstream. And when this happens, this can actually potentially hurt the unborn baby and lead to premature birth or miscarriage. So although I love charcuterie, I had to avoid it during pregnancy. The next myth is, and this is one my aunt told me, don't drink coffee when you're pregnant. And you know what, I have to say this, my aunt is wrong, but kind of right. So you can drink coffee during pregnancy, but in moderation. So caffeine is a stimulant and also diuretic, which means it makes you pee a lot. And this can increase blood pressure and also cause for dehydration. So what I looked at were actually one really good study published in the Journal of Food Chemistry and Toxicology that actually looked at, what dose is safe and what's not. And what they found was you can actually consume up to 300 milligrams of caffeine per day, and there's unlikely an adverse outcome in healthy pregnant women. The American College of Gynecology also supports this and says, you know what, you can drink coffee, but in moderation. So they recommend less than 2 cups of coffee per day. So after pregnancy, we gave birth to Maddie, and there were some more myths that I learned. The first myth, which was kind of the biggest shocker to me, was motherhood comes naturally. You will know what to do and you will love it. And for some, this could be true, but for me, this wasn't true. Motherhood wasn't as intuitive as I thought it was going to be. I was really, really tired. I remember for weeks and weeks and weeks postpartum, more tired than I ever had been during medical training or being on call. I was also really scared. Although I cared for infants and young children in my practice, when it was your own, it just felt really scary. I questioned whether or not Maddie was sleeping enough. I questioned if I was feeding her enough. I worried about her diapers and her poo, and I was really scared. I also doubted myself a lot. I questioned, am I doing the right thing for her? Am I doing the best I can do for her? Am I breastfeeding properly? And there was a lot of self-doubt. This was things that I never experienced before motherhood. The next thing is relationships change. For so much of my relationship with my husband, it was just me and him, and we were the only 2 people that we needed to think of. And after we had Maddie, it was such a blessing. We're so happy to have her, but she definitely mixed things up a little bit, and it changed our relationship. And this might not be the PC thing to say, but there were times when I missed my old life. I missed having fun with my friends. I missed being able to sleep in, to do things that I want to do just for myself. So it was definitely not intuitive for me. And I love being a mom, but it was different than what I thought it was going to be. And the reason I think that this is so important to bring up is that there are many women out there, many moms out there, many women in general that suffer from depressive symptoms, and they may not feel comfortable talking about it because of these myths out there that motherhood is easy and that everyone loves it. In fact, approximately 50% of women postpartum, within the first week of delivery, experience postpartum blues. So what postpartum blues is it's not depression, but there are some symptoms of depression. So tearfulness, feelings of guilt, feeling overwhelmed. And fortunately, this self-resolves within 2 weeks, but these emotions can be intense for the first 2 to 3 days post-delivery. And more common than I knew, approximately 9% of women suffer from postpartum depression. And postpartum depression has symptoms similar to depression: low mood, lack of interest, feelings of guilt, poor energy, difficulty concentrating. Postpartum depression affects not just the mom and the infant, it affects so many facets of life. And that's why I think that it's really important for all of us to be aware of this. Postpartum depression is associated with poor nutrition and health in the baby. It's been associated with abnormal development, cognitive delays in children. It has also been shown to interfere with breastfeeding and interfere with maternal-infant bonding. And it has also been shown to interfere with the relationship with a partner. The next myth that I encountered, that I learned about, and this is a myth that I actually believed after I had my kids. Sleep training is bad. If you sleep train your baby, they will feel abandoned and have mental health problems later in life. And I'll be honest, I didn't sleep train early on because of this. I was really scared to sleep train Maddie. And one thing that made me feel really bad was during my years of practice, I've reassured many parents that if they want to sleep train, it's safe, and they could do so as long as periodic checks were being made. And as a mom, I didn't even follow my own advice. So that made me feel really crappy about myself, because I don't want to be this person that's not practicing what I preach. And I definitely, in this situation, was not doing what I was advising others to. So what this led me to do was to do the research again. And what does the evidence say? So I looked at two studies and one excellent review article. And the first was published in Pediatrics in 2016. And what they found that two sleep training, common sleep training methods actually had no adverse effects on stress response of infants and no issues problems with attachment between the parent and the child. The next article I read in Pediatrics in 2012 looked at the effects of the common sleep training methods on outcomes such as mental health, sleep quality, and psychosocial functioning and stress tolerance. And they actually found no negative effects on any of these outcomes. And finally, a great review article was published in the Canadian Journal of Family Physicians and actually found that sleep training improves infant sleep problems and that maternal mood scales also improved with sleep training. And that makes sense because I look back and when I wasn't sleeping well, I felt super crazy and irritable. And once I started sleeping better, I found that I felt better. The next myth was something I heard in the nursing wards after I had my daughter. Everyone knows how to swaddle. And that is a myth because I definitely had no idea how to swaddle. That's my son, George, there. And he swaddled. I learned that swaddling is like wrapping the baby in the shape of a baby burrito. And I actually also reviewed why do people swaddle? And the reason people swaddle is there's actually some benefits that have been associated with this. So one, it helps infants arouse less and actually sleep longer, and has been shown in some studies to actually help soothe pain. It's also been shown to improve muscular development in preterm infants. However, there are some risks, and I think this is important for new parents to be aware of. It's helpful for keeping a baby warm, but there's also a risk that the baby can overheat. If the infant is swaddled with the legs kind of squeezed in way too tight, the infant is at increased risk of hip dysplasia. So that's some abnormal development of the hips. And another important fact is once the baby is able to roll, there's the increased risk of SIDS. So once the baby is able to roll, no more swaddling. Okay, myth 3. So this is something that my mom and my mother-in-law believe in strongly. You need to burp your baby after every feed. So there's sort of, actually not really, you don't need to. And the theory behind why people think that you need to burp babies is because while babies are nursing or drinking their bottle, they inhale air that kind of needs to get expelled after feeding. When you pat the baby's back or rub their back after feeds, this helps them bring up the air, and it also with the goal of getting rid of that tummy discomfort or reducing crying episodes. And you know what was really interesting was a study actually looked at this. It was a smaller study of 71 babies published in Child Care Health Development in 2015. And this study looked at babies who were burped to those that were not burped to see if there's any different rates of colic or regurgitation. And although this was a small study, they did not find there to be any effect on colic. So whether the baby was burped or not burped, no change in whether or not the baby was colicky. And they actually found that babies were burped or actually had higher rates of regurgitation than babies that weren't burped. So how did this affect our life? Well, it did not change my mom and my mother-in-law's belief in burping. They're still a strong believers in burping, but it changed me. I remember when I first had my daughter, Maddie, every time I would be trying to burp her for at least 20, 30 minutes. And when she wouldn't burp, I'd feel like I was doing something wrong. But then fortunately with Georgie, I would still try to burp him, but if I didn't after a few minutes, I wouldn't stress out about it. And I'd say, okay, that's okay. He doesn't need to burp. The next myth is one that I think is common and I really believed before I had my kids. Breastfeeding is easy and intuitive. It definitely wasn't for me. I found breastfeeding really hard. Expectation, you have, a Kate Middleton lookalike there, just looking like it's just so intuitive and so easy to breastfeed your baby. And for some, that may be the case. But for me, I really struggled. And it was difficult, and I had feelings of guilt and inadequacy that I struggled with breastfeeding my kids. And the reason I talk a lot about breastfeeding is that there is an association for women that struggle with breastfeeding and them having a higher risk of postpartum depression. In one study that looked at over 2,500 breastfeeding moms, they found that women that had negative early breastfeeding experiences were more likely to have depressive symptoms at 2 months. And they also found that women who had the intention of breastfeeding but weren't able to were at a higher risk of postpartum depression than those that didn't care whether or not they were going to breastfeed. My personal experiences and, reviewing these studies has really changed my outlook towards breastfeeding. I still encourage breastfeeding because we know there are multiple health benefits to breastfeeding. But I now realize that what moms need are support. So if you can breastfeed, that's awesome. But if you can't, that's okay too. Reach out for support and know that we will support you. But if you can't, that's okay too. There's other healthy and safe options to ensure that your baby is well fed. So now to my second year of mom life myth busting. Myth one, and this is something that I grew up with. There are no risks to screen time. I watched lots of TV growing up, and this was the case for me and my brother. We had no screen time limits. We didn't have to read books if we didn't want to. We were allowed to watch what we wanted when we wanted. And I'll be honest, we grew up, happy, chubby, and carefree. We had a great childhood. But as I read more and I talk to more educators out there and other healthcare providers, I realize there are risks to excessive screen time. The Canadian Pediatric Society has a statement that recommends that children under the age of 2 years do not get screen time. And for children aged 2 to 5 years, that we should limit screen time to less than an hour per day. Multiple studies have shown that excessive screen time can increase your risk of becoming overweight, sleep deprived, less school ready, inattentive, aggressive, and also affects your ability to self-soothe. So how has this changed me? So I grew up being able to watch unlimited screen time, and now I see all this emerging evidence that screen time is bad. Well, what I do is I always keep in mind what the recommendations are, and then I keep in mind what our real life is too. And I try my best to follow the recommendations, but I know our family isn't perfect. So both of my kids were exposed to screen time early on. I don't want to throw my mom under the bus, but it was definitely for my mom. My kids from the age of 6 months started watching Korean dramas, which I'm not crazy about, but both my kids had screen time early on. So they broke the Canadian pediatric recommendation of no screen time under the age of 2. We do in our house try our best to limit screen time to less than an hour per day. And when we are watching screens, movies, we watch it together and we try to interact as much as we can with the kids. We ask them questions about the movie, things that they like, and we debrief after the movies too. And on special occasions, when we're traveling or if, my husband's on call or I am, we just let it be and we break the rules. Perfect parenting doesn't exist. And I realize that more and more as the time goes on. So although I recommend reducing screen time, I can't say our family's perfect in this sense. Myth number 2, I didn't like reading as a child, so my child won't either. And you know what? This myth comes from me. I did not like reading as a child, and I just assumed Maddie wouldn't like books either. And I was so wrong. Maddie loves books, and books are so good for kids. An article published in Developmental Science in 2019 actually followed parent-child couples, the parents with their child between the ages of 1 to 2.5, and follow these kids from toddlerhood all the way to elementary school. And they found that the more the kids read in early childhood, the better their language and literacy outcomes would be in elementary school, and more internal motivation to want to read in elementary school too. And the Canadian Pediatric Society actually put out a statement that said, book sharing at bedtime is amazing. It's great. It's good for positively affecting the family, relationships, and also social emotional health. So the fact that my daughter loved books so much inspired me to write my first book about her, Maddie Monkey Learns the Body. And the reason I wrote this book was my daughter has always been interested in learning the human body. I think it probably has to do with my husband because I remember when she was just a newborn, he was studying for his rural college, and he would always look through the anatomy books. And I think that kind of got her interested in it. And I also wrote it because, I'm not very good at doing crafts. And one thing that I just wanted to make for Maddie was this book that when she's older, she could say, hey, my mom wrote this book for me. And that was another reason I wrote it. And the last reason was I found that Maddie learned a lot from books. She is obsessed with books. She'll look through the pages herself. And I said, you know what, let's do it. So that was my first book, Maddie Monkey Learns the Body, for my daughter, Maddie. So year 3 of motherhood. So Maddie and George are 2.5 years apart, almost 3 years apart, and Georgie enters our life. And one of my biggest fears about having a second child was, and I've talked to many parents, that worry that you love your first so much and you wonder, am I actually going to be able to love my second as much as I love my first? And you learn you do. Your heart just grows and you're able to love them both so much. And that was one of the most amazing feelings, seeing my 2 kids together for the first time and just feeling this overwhelming love towards both of them. Another thing that I thought was really cool was with the second child, I felt way more experience. I knew how to breastfeed now. I knew how to carry them. I knew how to do diaper changes effectively. I wouldn't have the most jumbo diaper bag. I could just have a little one with just the necessities. But there was also some worry. I worried about Maddie and how we were going to be able to adjust as a family of 4 instead of a family of 3. Maddie got so much attention, and sharing that attention was what I worried about, but she actually handled it like a champ. And with Georgie, I felt even more tired. And, at that time with the second child, I was starting to find the balancing was getting a little bit hard. With Maddie, 2 years of her, I finally hit that groove with feeling like I had work under control. I had parenting somewhat under control, and me and Grandma were getting back to our normal life, having some date nights. And then Georgie came and kind of spiced it up again. And then COVID hit. So as many of you guys probably experienced, COVID just caused so many emotions. I was not used to being at home all the time. And I'll be honest, me and my husband weren't used to seeing each other all the time. Maddie wasn't used to seeing me all the time either. And it was definitely different. I miss seeing family and I miss seeing friends. And I was really scared. I was scared of getting COVID. I was scared of my family getting COVID. I was scared of my friends and patients getting COVID. I was scared for society. And there were so many emotions. And then another dynamic happened was, how am I going to explain all of these things that I can barely understand myself to my kids? How am I going to explain social distancing? Why my daughter's not seeing her popo and gonggong anymore? Why I'm obsessively hand washing her hands and hand sanitizing? And what is this masking business? And this inspired me to write my second book, Georgie Shark and COVID-19. And the reason I titled it Georgie Shark was Georgie didn't really understand COVID. Like, he was still a little baby at this time, but I already had a book for Maddie and I wanted things to be equal. So I titled it Georgie Shark. And Georgie, you can kind of see from that picture, has kind of crazy spiky hair. So that's why that shark looks like him, with that spiky hair thing going on. And I wanted this resource to be able to explain to Maddie and hopefully Georgie in the coming time, once he got a little bit older, why the world just became so strange overnight, and why we needed to explain how I could explain hand washing, social distancing, and masking to my kids. And then I finally understood why people always say a picture is worth 1,000 words. And this book, after creating this book, I really realized how effective books can be as an educational resource. So with Maddie, she really didn't like wearing her mask at all. She said it felt kind of yucky on her face, and she didn't understand the purpose. So this image was created specifically for Maddie. So you have 3 sharks on one side, and one of the sharks is sneezing, and you see cooties flying everywhere, and it's spreading to the other sharks. And then you see what happens when people mask. And with this picture, just 2 pictures, I was able to explain masking to Maddie. Year 4 of motherhood, trying to figure out balance. And I kind of alluded to this earlier. I felt like I was getting into my groove after having Maddie for a year or 2. I said, we have our routine down pat. I was back at work, getting my groove back at work, seeing my panel of patients on a regular basis again. And Grandma and I were finally having a bit of alone time here and there. And then COVID hit. Georgie was there, who was one of the best things of our life, and I was struggling with balance. I felt like I was kind of doing a crappy job, and personally and also with work life. And I don't tell my mom this because I don't want it to get to her head, and sometimes we get into conflict, but she really is inspirational for me for how it balanced our childhood and also having a very busy career. And some of the things I learned from her was not to be afraid to ask for help. Our family is very fortunate that we're able to outsource for some of the household tasks that I'm not very good at, cleaning, meal prepping, things like that. We're able to get a lot of support for, and we also have a great support system with friends in our life prior to COVID. And one thing that I've learned is not to be afraid to ask for help. And this has been harder during COVID, but one thing that I do sometimes on weekends is trading childcare with friends. So if I have a few errands to do, I could say, hey, do you mind watching Maddie and George? And the next weekend I'll cover for you too. And that's been really great, that feeling of being connected with friends and family. The other thing is being organized. Even to today, my mom writes a list of things to do, even sometimes on weekends, and I've adapted that too. I use my iPhone calendar a lot, and I make a list of things to do daily so that I always can kind of figure out how to organize my day. This is what I struggled with the most, compartmentalizing. When I was struggling, when I was at work, I was thinking about my kids, and when I was at home, I was thinking about work. And I found I was less effective that way. Once I was able to compartmentalize, and what I mean by that is when I'm at work, I'm focused on my patients, focused on interacting with my colleagues and doing the best that I can. And then when I'm home, I'm focused on my kids and can leave work for those hours until bedtime. The other thing I learned was the importance of making time for yourself. Self-care is important, and to be able to care for others, you need to be able to care for yourself. And this is something that I'm getting better at, but don't feel guilty. My mom was really good at this. When I was telling her, I feel guilty for not being able to spend as much time with Maddie and George, she said, you know what, guilt isn't going to help. Don't feel guilty. Not going to help you, and it's not going to help your kids. And so when she said that, that kind of helped reset me. And I realized, you know what, let's take that guilt and throw it out the window. And this led me to my next book, Maddie's Mom Goes to Work. I was at home a lot for the first few weeks of COVID, during COVID, seeing patients virtually, and Maddie got used to me being home a lot. And she struggled when I started going back into clinic. And so I decided to write this book for her because I wanted her to know that even when I'm away from her, I still think about her all the time when I'm at work. And I also want her to know about all of the amazing opportunities and careers available to her. So year 5 of motherhood. So this is what we're dealing with right now. COVID continues. I think many of us are getting burnt out. And I think that mental health is becoming an emerging, very serious consequence of COVID. And there have been studies that have looked at this. One study published in Brain, Behavior, and Immunity in 2020 found that people with pre-existing psychiatric disorders actually had worsening of psychiatric disorders, worsening of symptoms in their psychiatric condition. They found that healthcare workers had increased depressive symptoms, anxiety, psychological distress, and poor sleep. They found that the general public had higher scores of anxiety, depression, and lower psychological well-being. Children were also affected. Sick Kids out in Ontario published a study in the European Child and Adolescent Psychiatry, and they looked at 1,000 kids aged 2 to 18 and 350 youth from ages 10 to 18. And they found that school-age children aged 6 to 18, 70%, and preschool-age children, 66%, had a deterioration in at least one domain of either depression, anxiety, irritability, attention span, or hyperactivity, and some of them in even more than one domain. Mental health is, I think, becoming a crisis as a result of COVID. And this led me to create my newest book, Coco's Bad Day, Tips for Getting Through a Hard Day. And this book was written with an Edmonton teacher, Georgia Miller, who has a master's in education, specializing in mental health and literacy. And what this book is about is actually, and that's our family dog, Coco, is about our dog, Coco, who is having a really crappy day. She's pushing other puppies, throwing her food everywhere, and not listening to her mom. And I wrote this book for my kids because we were having days like this where, the kids were struggling and I was struggling as a result. And what I love about this book is that Georgia and I created strategies for families to use on a daily basis with these everyday struggles to kind of help get over it. So one of the examples is something called butterfly hugs. And in this, butterfly hugs are a technique that's used by healthcare providers and educators as a calming activity. So when a child's feeling overwhelmed, and even sometimes adults, butterfly hugs are when you hold yourself like this and you tap left and right. And it's a soothing and calming activity. And so strategies like this we've included in our book. So this has been, motherhood has been the best experience of my life, but also one of the most challenging experiences of my life. This pandemic has been crazy, and starting a company during this pandemic has been busy, but also one of the most exciting things I've done. So what I've learned from all of these experiences is that these past 5 years with my kids has been some of the happiest years of my life, but also the most challenging. I've learned the importance of loving yourself so that you can take care of yourself, and so that your kids can also learn to love themselves and care for themselves too. I think it's important to do things that bring you joy and to go for it. For me, it was starting Life of Dr. Mom and by Dr. Mom. They challenge me but excite me, and I find joy in that. And this concept that it's important to take it easy on yourself because no one is perfect. So it's important to not expect perfection for yourself. If you want to get a hold of me, here's my email address. You can find me on social media and find me my books online. It has been an absolute pleasure chatting with you guys, and I look forward to having some great interaction.
I'm muted. Now I'm not muted. Thank you so much. I can say for sure that pretty much everything you said really resonated with me. Having 3 young kids. My oldest is 7, but 5 and 2, I guess now. So definitely resonated, I would say. All the way around. So I appreciate you speaking about your experiences as well, because I think that's really important. I know that I'm also impressed with how well you spoke about them, because I know even now if I try and talk about some of the stuff, I get a little bit emotional. So it was really impressive that you were able to open up and really talk about that stuff. So thank you. So there's a thank you in the chat. If anyone does have specific questions, please feel free to put them in the Q&A box at the bottom or in the chat box. The Q&A is kind of what it's meant for, but I can review both of them. I'm going to start off with a question, if that's all right, before I haven't seen anyone else jump in. My question is about attachment with like babies, because I remember having a feeling that like my child did not love me, which I felt was really weird at the time, but also very difficult. Is that like sort of, if you feel like you're having challenges maybe with attachment, how do you address that? Or do you have any resources or anything that we can use to address that?
Yeah, that's such a good question. And I think that it's hard because so many of us, like growing up, and like even what you see online, they say about this magical moment when you see your baby and you love them and you just feel this intense connection. I felt that, but it definitely took a few days for me. I had a bit of a slightly traumatic birth. And I remember like, I obviously liked my baby when I saw Maddie. I was like, I like you, but I didn't feel this overwhelming love that I was expecting. Sometimes it takes a little bit of time because birth, I think, can be quite traumatic for people. In terms of when attachment will start, I'm just trying to think of what resources there are. Did it happen after a while, or did it?
Yeah, I mean, yes. I mean, she's 7 now, and we're good.
Yeah.
But yeah, my first reaction here, everyone, and YouTube eventually, was that like I didn't recognize her, which was weird. I had traumatic type emergency thing. And I was like, is that my baby? So that was a bit odd and not what I was expecting. And then I couldn't like hold her and stuff. So yeah, the first part was not what I was expecting. So we're good now, but yeah.
I think many of us experience that. And now that you've shared more, that a lot of my patients have shared that with me and said, like, Dr. Lou, I don't know if like I feel as connected to my child as I should. And the first thing that I do is I actually validate them. And I said, that's okay. I said, everyone's different. It's not going to be like you're like the Disney movie right off the bat. It's like insanity, like love. A lot of times it takes time to grow. And most of the time of the patients that I've seen, it's just gradually taking time. I do follow them closely because sometimes I do screen for mood disorders too. And I also recommend, making sure that if you're not feeling attachment right away, making sure that you have supports in place so that you're able to get some rest and that you're able to spend time and not get overwhelmed, because it's hard to feel attached to a baby that's kind of going crazy too and like crying and getting all colicky. So I will look to see if I have an actual resource, but a lot of the times I just talk it through. And I think that a lot of times once you feel validated and you realize you're not the only person out there and that it's a safe place to discuss it with healthcare providers, a lot of times once that's discussed, attachment just starts to grow.
Yeah, thanks. I mean, if you do have any resources afterwards, we can share them with the members who are attached or who've attended, and when we send out our sort of review at the end or follow up at the end. Okay, we do have some questions here. We're getting more. Have you seen an increase in your patients wanting to talk about symptoms of anxiety, depression since the pandemic?
Yes, so much. I've, some patients with pre-existing mental health disorders such as depression, anxiety, their symptoms have gotten worse too. Social isolation has really precipitated mental health problems. And some patients without even a history of any type of mood disorders are struggling. I think it's really hard because, hobbies, seeing friends, doing activities, staying active, when you take that away from people start feeling sad and isolated.
Yeah. I think the next question is similar. Do you think the percentage of PPD would be higher than 9% if it was not associated with shame?
I think that's a really good question. And I've thought of that too. Because, yeah, I wonder. And I think that we're learning, I think that rates will get higher. Like we'll see that it's going to get diagnosed more and more, because I look at how I am in my practice after having my kids, and I realize that I screen for it way more. At every postpartum visit, I always say, hey, like, how are you doing? I found it really hard. And so I'd start out with a line like that. And I find that a lot of people are way more open.
Yeah, I mean, I remember going to appointments, when the kids are reading their vaccinations or whatever. I'm like, how are you doing? I'm like, yeah, I'm fine. It's hard and whatever. But at the same time, I think it's challenging to also then say, you know what, this is like, where is the level of hard that's acceptable kind of thing. And where does it sort of reach a point where you need someone to talk to or some additional assistance. I don't know if there's an easy way to figure that out.
I think that so what I always say, and I've been asked that for patients, like, when do I need to worry? I always say that I think that whatever you're feeling, whenever you feel like it's affecting your function, your daily life, your quality of life, I think it's important to check in with a healthcare provider. Because we know that the person asked about the shame, and I think there's less and less of a stigma with mental health, but there are some people that feel uncomfortable talking about it because they say, you know what, I might have this like perceived perfect life. I've got all these supports, financially I'm stable, and I feel sad and I can't explain it. And they don't feel comfortable talking about it. So that's why I think events like this are so good, because we're talking to people about it and we're stimulating this conversation. And hopefully if someone feels really stressed out or sad, they feel like they're more likely to talk about it after we're kind of chatting about things like this.
Yeah. Oh, I appreciate that. Our next question is about, do you have any recommendations for little ones who is aggressively addicted to the phone and can't handle seeing a parent on their phone FaceTime is challenging, always ends in tears. Do you use phones during mealtime? This person's child eats a lot better if they're in front of a screen.
You know what? This feels like it's like my daughter. So, me and my mom got in the most epic fight because, me and my brother grew up with screens. We would eat TV, we would eat our meals and watch TV. And, probably you guys could see from those photos, me and my brother both battled childhood obesity, at some points in our life. And with my daughter, after spending time with my parents, she is aggressively addicted to the phone and she expects it for mealtime. And one of the hardest things that me and my husband have to do is kind of almost to reset her. So, when she sees me answering a phone call, she'll be like, can I get the phone for like 2 minutes of YouTube? And I say no. She gets upset. But what we found really effective was just consistency with her. And so after being with my parents, when she gets the phone, she aggressively wants it for, I would say, at least 1 to 2 weeks. But every time we would just be firm. No, Maddie, it's at designated times, and redirect her. She would get upset. Okay, well, what about this game? And redirect. And I find that redirection is really good in the toddler age group because, they kind of have short attention spans. And once you direct them to something else really cool, like I'd pull out stickers, I'd say, no phone, but you have stickers. And I throw out the stickers there, and she would actually get quite redirected to that. The second question was the meal time. So in general, at home, we try our best not to let our kids eat with the screens there. But when we do go to restaurants, we do allow for that. I also do find that my daughter eats a lot better when she does have a screen in front of her, but we try not to let that be a habit.
Okay, yeah, I think that covers that. The redirection is key. Stickers are also key. For little kids, they love them, put them on everything. Okay, so the next question is, what inspired you to create your company and to share your parenting journey so honestly?
Yeah, so I started the blog, and I kind of touched on this earlier, because I really do think that there is so much misinformation out there, and it really is hard to discern what's credible and what's not credible. I have a master's in science, but I was falling into those mom blogs about saying how bad sleep training was. And I even remember the evidence. I remember learning about sleep training during my medical training, but I fell so into the mom blogs. And I realized, I said, I want to create a resource where people feel like it's relatable, trustworthy advice that's actually evidence-based. So that's what made me want to create the blog. And then with the books, I started it for my kids. I think it's fun for me to be able to tell my kids, 10 years down the road, I made these for you. And I love that there's that educational component, that my kids like it, and hopefully some other kids like it too.
I also loved your comment about not being super crafty. I am also not super crafty, but I try. Maybe I should start writing books. I don't know. No, I think that's fantastic. Our next question is, do you have any thoughts on little ones who want to read the same book over and over again? Is there value in reading the same book multiple times?
My kids are the same. They get into these patterns where they'll want to read the same book every night for like 3 weeks. And I actually talked to an educator about it, and there's a lot of benefit for them looking at the same book over and over again, because the repetition is useful, and it also could help with word recognition too. So I think there's a lot of value still in it. My kids, it's just hard for the parents when you read the same book over and over and over and over and over again.
And maybe you skip a page and then they remember, and then you.
Yeah.
I don't know if anybody else does that. Okay, the next question is there a specific time period for PPD, or a time when it's too late for something to be considered PPD?
That's such a good question. I don't know if there's I need to look this up on the DSM-5, like the specific criteria, but I think that, postpartum depression often occurs like immediately postpartum, but I've seen it present in moms, months afterwards, 6 months to a year afterwards. And, they're actually modifying the term, calling it peripartum depression, because during pregnancy, people are also diagnosed with depression too.
Oh, that's interesting. That's good to know. I don't know if there's a question in the question. Oh, there are. I just hadn't scrolled. How old was Maddie when you gave in and decided to try sleep training?
Way too late. I wish I did earlier, but we did around 10 and 11 months.
Yeah. I think for me, I was just like, you can sleep. It's fine. You'll survive.
And then she slept and it was so great.
Yeah.
But you can typically start sleep training somewhere between 4 to 6 months, as long as there's no concerns about growth and development.
Is that something that you would speak to a pediatrician or a healthcare provider about when that would be appropriate?
Yeah, I always say that it's probably good to check in with your healthcare provider, because there's some situations where if the child is under a certain weight, sometimes we recommend still continuing the night feeds. But yes, check in with your healthcare provider, but somewhere around 4 to 6 months, you can start sleep training, considering growth and development are normal.
This isn't on here, but I don't see another question in the question and answer box. So I'm going to jump in with something that you didn't touch on, but I'm curious about. Introducing foods to children, to babies. So our pediatrician gave us a piece of paper with a pretty sort of detailed plan or plan of action kind of thing, and what types of foods to introduce first, and then moving on to, so we did grains and then vegetables and then fruits and then meats. So it was sort of a whole process. And I'm just wondering if there's any recent research or anything that you know of that you can speak to on introducing foods and solids.
Thank you so much for bringing this up. I realized I should have put in this one myth: peanuts and allergens. So back in the day, like, doctors really messed things up, because we used to say back like years and years ago, don't give your baby peanuts until they're a year of age. That is so wrong. Early introduction of peanuts reduces allergies later in life. We actually should be introducing allergens like peanuts, eggs early on in life. And these two allergens, for example, early introduction reduces allergies later in life for these two things. Iron fortified foods, iron rich foods are probably one of the first things I recommend, because once around 6 months, baby's iron stores start to go down, and there's not much iron in breast milk. So that's why I recommend one of the first foods to start is iron rich foods.
Okay. So like, do cereals are fortified with iron? Yeah. Okay. That makes sense. Oh, cool. The next question is, would you be willing to share a highlight and a low light from your parenting journey? Yeah. So I feel like you've shared a number of different ups and downs, but yeah, are you willing to share?
Yeah, for sure. Okay, these are like recent highlights. So one of the best feelings when I come home right now is that both of my kids like run to me, and they're so excited to see me. And it's just the best feeling ever, because I'm not with them during the day, and you worry, like, are they still going to like be all over me? And this sounds so rude, but they almost like, okay, bye to their nanny and just all over me. And it makes me feel so good. The biggest low time, and this actually led me to take some time off of work, was when my daughter was, I think, not a little over a year, like somewhere in the 12, 13-month mark. And I came home. I used to do inpatient call at the U of A, and I was so excited to see her. I remember counting down the times, and I'd just go see her. And I said, Maddie, come to me. And she wouldn't leave her nanny. And she kept saying, Ruth. And I remember, this is so unreasonable, I was so mad at the nanny. I was like, I want to talk to her. I said, Maddie, just so you know, I said, I'm making the monies, okay, so that you can, which is obviously crazy, right? And looking back, I should have been so happy that my daughter felt so attached to her nanny, but I was incredibly jealous, and I've had feelings of anger towards my daughter, which was crazy, and to our nanny, but that fortunately faded right away. But that was the biggest low.
Yeah. I think last night or the night before, honestly, my littlest one cried for like 20 minutes and kept saying, Lissa, Lissa, Lissa. And our nanny's name is Melissa. Like I was like, I'm here. You've been asking for, no, don't want me anymore. All right, then. You never know. They go all over the place. Okay. I know there's a question in the chat, so I'm going to hop over here. Is there a difference between family allergies versus the top allergens?
What did we miss that?
Family and no, so it's in the chat rather than in the question.
Oh, chat. Okay.
Yeah, so I'd seen it.
I need to read the process too sometimes.
Pardon me?
I said sometimes I need to read. I was trying to read and I realized it wasn't the. Can you say the question again?
So is there a difference? It says, is there a difference between family allergies versus the top allergens? And I'm not. Oh yeah, okay.
So the top, like the most common allergens are things like peanut eggs are quite common allergies, and they also can be a family history. So you might notice that some people, some people may have a family history of peanut allergies too.
Okay.
Am I answering it correctly?
I think maybe that's what it is. Like if you have a peanut allergy, like is there a difference in how you introduce the allergens?
Oh my gosh, that's such a good question. Yeah,
I think that's probably what
that is the best question. So I struggled with this too, and I actually spoke to an allergist because the American recommendations versus the Canadian are different. So there are some babies that are known high risk. So like with family history, eczema is also another risk factor for a peanut allergy. And in the US, just because there are more allergists available, some regulating bodies say, it's better to see an allergist to get tested first. In Canada, they say you can, like if there's like parental anxiety, see an allergist first. But a lot of us, just because it's so limited and it's hard to get in to see an allergist, often they'll say, start the allergen, which would be peanuts, but make sure that if you have concerns, you take the child to emergency right away.
Okay. Yeah, I remember like the first time I gave each of my children peanut butter or strawberries for some reason. I think because there's like a grandparent who's allergic to strawberries, but I was just like, okay, are you okay? You're okay. Always a bit stressful. Okay, so I'm going to go back to the Q&A. So would you rather write more books or practice medicine, or are they always going to be totally connected for you? That's the question.
Okay, 120%. I will always practice medicine. Like that's what I trained to do. I love it. I don't work as much as a family doctor as I would like to be able to. So I just work part-time as a family doctor. But I love it. That will never change. But I also really like books. And now it's been great because I think George is watching here too. I get to connect with other, people from different disciplines that teach me so much. Like George has taught me a lot about education strategies for children, which, sometimes I really struggle with my kids. So it's great having an educator with that experience to be able to help me. So yes, they're always going to be intertwined in my life.
Cool. Do you have any advice if a little one prefers one parent over the other to try and include the less preferred parent?
Yeah, so I'll say I'm pretty lucky right now because, my husband probably doesn't want to hear this, but I'm the favorite for both of my kids right now. And it feels so good. It feels great. But one way that I try to get Graham involved more is bedtime. So story time, my daughter just loves him reading books to her because he'll read multiples to her, and it's kind of a special time. So to get it's bad to say less favorite parent, but the less favorite parent involved is let them do the cool stuff. Let them do the cool stuff, so let them do the glory, like the reading to them, where I'll do the less glory, I'll do the brushing the teeth. Or if you're going to the park, let them push the kids in the stroller and you hold the dog. So yeah, that's what we try to do. And if it's with like going for ice cream, and if I have something to do at home, let the less favorite parent do that by themselves, and that really lets them get some of that parent glory too.
Yeah, that special bonding time, and they get that nice interaction. I think that just grows the relationship, right? Okay, going back to the chat box. It says, during COVID, is it a good idea to bring 6-year-olds or 7-year-olds for annual checkups? when they are healthy?
Yeah, that's such a good question. And I personally, like, there are probably other healthcare providers that would disagree. I still think it's important to see your healthcare provider. The reason is that a lot of times things come up. I always see, like, once a child's old enough and they don't mind speaking to me alone, I always do talk to them alone. And that's because, you know, even if there's nothing that's physically wrong, there's things that go on in school. And sometimes there's things that are hard to talk to your parents about. And it's sometimes easier talking to a third party. One of my patients, she's 9 years old, but she's like functioning like a 20-year-old. She's just so intelligent. She's gone to that gifted school. And she was struggling with some depressive symptoms. And we've been seeing each other regularly. And she disclosed to me that she's struggling with some gender identity issues. And so that's why I always think it's good, like, for these check-ins, like, not necessarily checkups for physical stuff, but always check-ins to see how life is going, you know, talking about what's going on with school, how is the communication with parents. So I always say, yeah, it's always a good idea, even during this pandemic, to get checkups.
Yeah, that's great. And it's great that they felt comfortable enough to share that with you. So clearly, well, we all knew you were great, but clearly you were extra great. Okay, the next question is, what's most standout best advice you got that you would like to give to new moms? Okay, sorry, I'm going to restart. Most standout best advice you got that you would like to give to new moms? There's just too much good advice. That's the thing.
No, this is like, I was trying to think, it's something that my mom said to me, but it's so harsh, and I want to say it in a nice way and not as harsh, because her message is good. It's just like a little bit mean. So I think it's kind of what I talked about too. She said, like, there's no such thing as a perfect parent. And she said that too. She's like, do you think that I was perfect? And I was like, no, I pointed out this, and this flaw. And then we got into a little bit of a disagreement about that. And she said, but look at our relationship now. Like, me and my mom still fight, but we are still so close to each other. And I think that goes with, you're going to make mistakes along the way, but in the big picture, as long as you're doing your best, things are going to be okay. And I think that that's the whole message, and that perfect parenting doesn't exist. We'll all make mistakes. We'll probably all get our kids mad. We'll get mad at ourselves, but we're all doing our best, and to just take it easy on yourself.
Yeah, to be kind to yourself, I think, is a big thing that I definitely struggled with when you were talking about, you know, thinking it should have come naturally. And I definitely thought it should come naturally and was not as natural. I don't see any more questions at the moment. If anyone else has questions, please jump in. I am going to then hop in with another one. I have at least one child who has some pretty big emotions. We've taken steps in the last, I guess, 6 months to have her speak to a counselor about them, just to sort of talk about how to regulate. Do you have any tricks or tips on helping children sort of regulate those big feelings once they get them? We're now talking to her about, like, being in, like, a red zone, and we're like, hey, you got to come out of that red zone because you can't hear me, and we're not gonna get anywhere at this point. Do you have any? Maybe that's not a good one, I don't know, but do you have any tips or tricks?
This is like actually what Georgia taught me, because I find, like, Maddie's now almost 5, and we actually, when she's mad, I'm like, why are you mad? What's wrong? Why are you mad? Talk to me. Why are you mad? And then when she's in that phase, she, like, doesn't want to talk, similar to adults. And what George taught me is, like, there's these safe times to talk, right? So when it's bedtime and story time, we're quiet, or if I'm combing our hair, or if it's after bath time and we're chatting and things are going well, it's when things are calm. And that's that comfort, well, I can't remember what her phrasing was of it, but it's that time when, you just feel zen and you feel open to each other. It's that open time to communicate. I would say those are the times when you ask them, what's going on? Are you okay? Or how was your day? And I've been working with Maddie to ask more open-ended questions, like how was your day? Instead of what did you do today? Did you learn this? Did you learn that? I would just say, hey, how was it? And let her guide it.
Yeah. No, I think that makes a lot of sense, because when kids are sort of in that full meltdown mode, they can't quite hear anything. Yeah. And I mean, adults are the same way. So that makes a lot of sense. What is the best parenting book or maybe podcast that you've read or listened to?
Well, you guys probably know I don't like reading, so I don't really read books. So I don't read books. Best parenting podcast. You know what? I'm really into like self-help things. So the podcast, it's not about parenting, but one thing that I'm trying to learn more about is, I think I'm a goal-oriented person. So there's all these things that like I want to achieve and I want to like get better at and do better at. And one thing that I'm trying to understand and appreciate is like living in the moment more and being more happy. Like I'm happy, but I think I can be more happy with all of the amazing opportunities in my life. And the podcast is called the Happiness Podcast. Let me just see. And it's Habits for Happiness. And that's what I'm listening to.
Cool. Yeah, I think that's, I mean, appreciating what you've got and looking at the positive parts as opposed to being like, okay, what can I do better? Because I think we all do that. That's cool. I think so. There was a comment from someone, Janet Lansbury, for parenting. Was an option for, I think, a podcast or maybe a book. Melanie said, "You're amazing. How do you juggle it all?"
Like Melanie Nakatsui?
Yes.
Melanie, I think you're amazing. Okay, we have this mutual affection for each other. Thank you, Mel.
But she wants to know, how do you juggle it all?
Oh, like literally.
Well, it's in there, so let's do it.
So I'm really lucky. I'm a bit of a slob, and I have the most amazing nanny who helps with like kind of the daily stuff. Laundry, cleaning, meal prepping. I like cooking. I like doing the glory part, like the seasoning, but she helps with the meal prep in the evenings. I use a calendar like crazy on my phone, which helps. And it's hands-free driving, but I don't know if you guys find this too, but I drive a lot with the kids. So sometimes if I feel like I can get there safely, I do hands-free driving sometimes for phone meetings.
Oh, I've not tried that. That's cool.
Only if it's safe, and it is.
So one other thing that it's not on here, but I was wondering about routines. So I think there's some discussion about routines being really important for kids. How important are they? Like, do you have to have a bath every single night? Is that an important routine for going to bed? Do you have any advice or tips on that?
I didn't think routines were that important. And that's because I didn't really grow up with routines. Like my mom, as I mentioned, worked outside the home. So sometimes if she was working late and we get home really late, we'd be allowed to stay out with her. And in my parents' mind, they'd say, what's the big deal? You just, you sleep more the next night, you go to bed the following night. And I tried that with my kids because I want to be cool. I want to be this freestyle parent that doesn't have like a specific bedtime. They don't have to eat at the same time, because that was how I was raised. But for my kids, they struggle. They need a routine. And I think it's a healthy habit for all of us to wake up at a similar time every day, to eat around the same time every day, to have activities, to plan some exercise. So with my kids, they need a routine. And I think it's good because it also gives them security. They kind of know what to expect every day.
Yeah. My kids seem to enjoy routines. I mean, they love running around and doing their own stuff as well, but then they get a bit out of control. Actually, which makes me, so I know we talked about screen time. Has there been studies, or do you know research that talks about some of the effects of having a lot of screen time? For example, personal experience. If my kids end up watching a lot of TV one day, they're a bit more like terrors in the evening before bed. I feel like maybe they haven't gotten their energy out or something. Is there any research on that, or is that, yeah?
No, studies show that that excessive screen time is not good for like development, self-soothing, and like emotional regulation. It messes up impulse control. And I find the same thing. Like, I'm surprised I wasn't like a psychopath growing up with the amount of TV I watched, because I would think that I had no emotional dysregulation. But yeah, no, I agree. My kids are the same way. They cannot handle that much screen time or they go crazy. And that's why we really try to limit it, other than those special occasions.
Yeah. And I liked the comment about, you know, when they are watching TV, spending time with them. Because sometimes I will say, here, it's your TV time. I'll just go tidy up the kitchen or like do something I need to do. Whereas it's much more valuable. And when I sit down with them, they like snuggle in, and that's really quite rewarding. So I liked that, and then connecting that with what happens in our house. So thank you. Okay, I'm going to ask if there's other questions at the moment. I think we've covered all of them. If I haven't covered your question, let me know. So I guess before I do a quick wrap up, was there anything else you wanted to touch on or talk about before we say thank you to you and then to everyone for coming?
No, I'm just so thankful that you guys had me to be able to chat with you guys, and I really enjoyed the Q&A session, and thank you guys for organizing this.
Well, thank you for coming out. I guess not out, virtually. We're still not going anywhere. All right, so I don't see anything else that's come in. So I wanted to take this opportunity and to say thank you very much for taking part in this evening. And to everyone for continuing to make this online event and community amazing. We definitely learned a lot. I learned a lot. I feel very, very validated in a lot of things, so I appreciate that. Thank you. So yeah, we're just so thankful for you that you came out and spoke to us honestly. And you can see if you open the chat as well. I don't know if you have it open, but there's lots of love in there as well for you. So for those of you who are attending, if you want to continue, if you'd like to continue to support the Women's Society, we'd love for you to consider donating or becoming an active member if you aren't already. For information on that, you can visit our website, and I think it may go in the chat box in a minute, but the website is lhhwomensociety.com. Or you can reach out to us with any questions. I also want to say another big thank you to Alberta Blue Cross for sponsoring What the Health. Yeah, so the website's there in the chat box now. We're happy to be back. This is our first What the Health of the fall in our next season. So we're excited to be back. Our next lecture is going to be scheduled for October the 21st. Again, same time, 7 to 8:30, and we're going to be featuring a speaker from SACE, so the Sexual Assault Center of Edmonton, and we'll be sending out some information on that probably in about 2 weeks. So thank you all for attending, and I wish you all a safe and wonderful evening. So thank you very much. Did you get to scroll through and see the thank yous?
Yes, I scrolled through.
Yeah, there's big hearts.
Thanks so much, you guys.
Yeah, thanks for coming.
Thank you. That was really good.
Great.
Thank you so much.
My pleasure. Thanks for having me, Lisa and Crystal, Rhiannon, and where is Paula? And Paula, I don't see you.
I can hear you. I'm here.
Okay.
Thank you for everything. I'm going to end the webinar for everybody. So good night and thanks again. See you in October.
See you
Thanks, everyone.
Bye.
Good night.
Bye.
Bye.